because she knows what she's talking about. I'm mad as hell because we don't know what we're missing. I just got back from Canada. My friend there, he was in the hospital for 5 days. He got out of the hospital. He was in a private room for 5 days. He got out of the hospital. He was pissed. He was mad. He got a medical bill. He got a bill from the hospital. I said, Red, you got a bill from the hospital? This is Canada. You guys get free care. He said, yes, I got a bill from the hospital. Private room, $278. Folks, you could not spend an hour in an American hospital for $278. And that's why I'm mad.
One of the things that we hope to do here is to impart some real practical information so that everybody leaves here better able to think and speak about what single payer is and what the issues are. So one of our doctors, Dr. Paul Hochfeld, is also a documentarian. And he's made a documentary called Health, Money, and Fear. I'm going to let him intro it. We have an excerpt from it that is really just sensational and really informative. Paul, you want to give a lead in?
Yeah, about 3 or 4 years ago, my job was driving me crazy. And so I just knew it was a crazy non-system we were working in. I didn't know really what was wrong with it. And so I started an exploration. And I checked books out of the library, and I found the names of people who seemed like they knew what they were talking about, and I naively contacted them and said, I'm going to make a video, would you give me an interview? And they gave me an interview, and the exploration led me to conclude that our healthcare system is broken because it costs too much. And the solution to it is single payer. I didn't start out the video project wanting to advocate for single payer. It led me to that by looking at the evidence. And while you're watching this, you need to remember that 60% of every healthcare dollar is already funneled through the government. And until we're willing to let people die in our emergency room doorsteps because they don't have coverage, we're already taking care of everybody anyway. So, and focus on the perverse incentives that drive up cost and don't add anything to care. Too deep into talking about why single payer is the solution. And the other day a reporter was asking me about the single payer option, and I said, no, it's the single payer solution. It's the public plan option, which is, as it's written, is going to probably fail, but it's the single payer solution. So why don't we define our terms?
Single payer, a system of payment that redirects all current healthcare monies into a single public fund that covers everyone.
Is that clear? That, again, going back to this goal of getting everybody out coming out and being able to talk about what single payer is, we're talking about taking money that's already being paid into the system and redirecting it, and it's going to private insurance companies, and redirecting it into one fund that covers everyone. It's not all this other stuff. It really is just a system for redirecting money into a single public fund. Has everybody got that? Good. I think that's super important. If we achieve just that much, we're going to do questions and answers in one second. Why don't one of you try to describe what the public option is? What is the public option, so that everybody understands? Aside from that, what are they proposing with the public option?
Right now, the proposal for the public option leaves the insurance companies intact, and it leaves people that already have insurance intact. The problem with that, as we see it, is that the insurance companies want to cover people that are healthy. So who does that leave? That leaves the people who do not have jobs, who are not healthy, who have lost their jobs because of ill health. It leaves the sickest group covered by that option. Well, as we've seen in this video, if you're running an alternate insurance, you don't want all the sickest people. It's more destined to fail. I don't want the profits to stay with the insurance company. I want those monies to go into healthcare for everyone. That has a much better chance of succeeding.
So a successful healthcare system would remove profit, and that's pretty uniform across the world. Am I right that the successful single-payer systems that exist around the world in many countries, it's illegal to make a for healthcare, the insurance can make a profit. Is that correct? Do I have that right? Okay. All right. We're just trying to establish some baselines, and then I want to get into some of the other questions. One of the questions that's come up for us a lot more is, so is it going to cost more? Clark?
The answer is flat no. That's simple. We spend 2.4 trillion with a PR truck on healthcare in this country every year, this year. 1/3 of that, $800 billion, is what is wasted on administrative and profit-making activities. You have 1,300 different insurance companies that a doctor has to deal with. Every time you go to get a Band-Aid put on, you have to pre-authorize something, don't you? The doctor. That $800 billion is far more than enough to provide gold-plated health care for every person in America that doesn't now have it.
Joe, why don't you talk about how we transition? You want to talk about how we transition?
Well, if I just might add just one comment about whether it's going to cost more or going to cost less. I would like to urge all of you to go online and read about HR 676, Representative Conyers' bill, which forms a basic plan for a single-payer system. And it goes into the funding of that system, how the money would be raised. And basically, again, it's all of us paying our fair share. The Congressional Budget Office, using these funding mechanisms that are outlined in this bill, have estimated that a family of 4 with an income of $56,000 a year would have a total health care cost covering all of their health care needs for $2,900 a year. Did you get that? A family of 4, income of $56,000, their total health care cost would be $2,900. Can you imagine the savings that all of us, even those of us involved with Medicare, with our co-payments and our deductibles and all that, can you imagine the savings that we would all realize by going to an efficient single-payer system? Now, do you want me to talk about
No, let's go to questions. Let's go to questions to the audience. Are you ready?
I just had to add something, and that is that when you're talking to your neighbors, and I hope that what you get out of this, what we hope you get out of this is some talking points. So that you can talk to your neighbors and go up to people in coffee shops and say, what do you think about healthcare? And have an intelligent discussion with them. We are fiscally conservative. We can't spend more money on healthcare. It's killing us. And the way we can cover everybody without spending more money is to get rid of the 1,300 insurance companies that the health industry is servicing. And it's not more money, all right? If they want to break the government's back, keep spending the money on insurance companies.